And good morning, everyone. Welcome to the webinar. Today is part 2 of our series with UnitedHealthcare ACA. I'm with my friend and colleague, Mitch Flowers. He's on the other line. Can you say hey, Mitch?
Good morning, everybody. Thank you guys for joining today.
Yeah, and we're going to go over some prior content and some new content from last week. So let me just scroll through a few housekeeping things. If you got a question, you put it in the question box to the right, and I'll monitor these throughout the presentation. Today will be about, half an hour or so, 35 minutes. We'll try to answer all the questions at the end of the presentation. If you're having an issue with the sound or something like that, I'll also put that question box because I monitor that throughout. And here's our dynamic duo of the individual market. This is me and Eric. And there's my contact information, and there's Eric. Eric is more of a specialist on the technical side of things, particularly health Sherpa and those kind of issues. So by all means, reach out to us and ask any question you have about the individual market. Earn up to $7,000 with Cornerstone's cash incentive program. Earn more when you sell more for all group and individual new business between the first of this year and December 31st. You can earn up to $7,000 by accumulating points throughout. You can register on our website there. There it is. And the new and improved AGB portal is now available for our broker partners. It's your one-stop shop for managing your book of business through Cornerstone, from carrier and client information to commissioning schedules. If you have any questions about the new platform and your access, please reach out to your broker advisor or the AGB support team. Just give us a call. And let's toss things to Mitch. I'm going to hand this off to the magic of technology and make you the presenter, Mitch. Okay. And then we'll go to your slides.
All right.
Okay.
Let me know if you can see that, Geoff.
Yeah, I can see it. Yeah, great. I'll just turn off my camera, give us some more bandwidth, and take it away.
All right. Well, I appreciate that, Geoff, and I appreciate the time once again this week, and also appreciate everybody joining us this morning as we're halfway through the week, heading towards the weekend. It's supposed to be a pretty nice day here. Sounds like in your neck of the woods in Cincinnati, and it is here in Columbus, so hopefully everybody gets a chance to enjoy the maybe a false spring here, or maybe we're heading into spring. Either way, hope everybody gets a chance to enjoy it. So just plan for today, have like a quick presentation, as Geoff mentioned, about 30 minutes or so. And really the point of this was just to provide you guys all with just sort of a quick guide and somewhat of a refresher of some of our unique incentives, our unique benefits, some of our plan offerings that we offer as we are into SEP period here. Also wanted to provide some market insight into some of the data from OEP in terms of what plans sold the most, what are some of the hottest counties that we performed in Ohio, and just so that you guys kind of have that market insight. So a little bit more on the agenda for today. Like I said, going to touch on some of our unique plan benefits, then dive into our incentives that we offer on those plans. We'll touch on our virtual first plan after that, head into ancillary benefits, go over some of the benefits that we provide in that area. And then, like I said, we'll touch on market insight, some of our network additions, and then we'll touch a little bit about the bonus and retention program as well at the end. All right, so starting off with those unique plan benefits and starting off with some of our national offerings here. So 4 big points here that we have incorporated that really give us a unique stance in Ohio, whether it was just taking feedback from previous years and incorporating that into our strategy for this year. First one being no cost doctor visits. So this is a big one. When you guys are talking to your clients, of course they want no cost doctor visits, a big one there. So a lot of people are offering that nowadays. So we've incorporated that in all of our plans, whether it's $0 virtual urgent care, and $0 primary care as well. So I will touch a little bit about that on a future slide. In addition to that, low-cost prescriptions, another important piece of the pie here. So we are continuing to offer our $3 or less tier 1 generics through our partnership with Walgreens. In addition to those low-cost prescriptions, UnitedHealthcare ACA plan members will also enjoy a 20% discount on every single Walgreens branded items as well. So whether it's bandages or over-the-counter medicine or what have you, any sort of Walgreens branded item, UHC members will enjoy a 20% off discount on all those items, which is pretty nice. Our wellness on a budget, another unique incentive that we offer is through our partnership with Peloton. We're continuing to offer that complimentary 1-year Peloton all access fitness membership. And basically what that is a member is going to get access to Peloton's massive library of digital workouts and fitness regimens. And the great thing about that is you don't need the bike or the treadmill to take advantage of all the great fitness advice and workouts that Peloton offers. They have just an absolutely massive category of virtual workouts and exercises that all of your members will get access to on an ACA plan. And then lastly here, that $100 member reward. So in addition to all the other 3 points here, members will also get a $100 member reward card for just completing a couple simple steps. And I will touch on that as well. So some of our unique offerings just to keep in mind when talking to customers that you have, things that we offer that they might not be able to get anywhere else. Now circling back a little bit to our free virtual urgent care and then our free primary care. Big point here, the $0 primary care and the $0 virtual urgent care. So this really came from feedback from our partners and what they wanted to see on our plan. So we listened, we introduced our $0 primary care and that $0 virtual urgent care. So on all of our product families, you're going to offer a combination of either. So for our essential value and our advantage plans, those are just our traditional plans that you see. They are going to offer that free in-person primary care to all the members. So in addition to that, we also have our virtual first plan. So that's our complete virtual plan. And in that case, members are going to then receive the free virtual primary care. So once again, the essential value and advantage plans receive that free in-person care on all of our plans offer that. And then for our virtual plan, they get the free virtual urgent care as well. So some big points here. And we are continuing to add these sort of benefits in our plans. And as we strategize for 2024, new information will be coming out soon as well. As for those member incentives, once again, offer a pretty nice incentive package for our plans that members have really enjoyed over the past several years. So once again, that member incentive for this past year, for 2023, we increased it. It used to be a $25 card. We bumped that up to $100 for the past year. And I believe it might even be going up for 2024 as well. So stay tuned. So they get that $100 member reward card for simply visiting their PCP, turn on auto pay, opt into communications, and then they get their $100 gift card and they can redeem it through our partners at Walmart, Walgreens, or Amazon. And then in addition to that, that digital fitness app, that Peloton membership, they will enjoy that as well. So all they're going to need to do is enroll in a qualifying plan. They're then going to get an eligibility and access code, and that's it. They can download the app and they can start enjoying all the workouts and exercises at their leisure. And it's a really great app. Our members have really enjoyed it. There's a ton to do on there. Once again, you don't need the treadmill or the bike to enjoy it. If you do have the treadmill or the bike, then you get the access to those great live classes, but you definitely don't need it to take advantage of it. There's a ton of workouts, as you can see, cycling, running, boot camp workouts, outdoor strength, you name it. There's a bunch of stuff on there. And then last, this is a really unique offering for our ACA plans, is through our partnership with AARP. So as many of you may or may not know, UnitedHealthcare is the only carrier to carry the AARP brand. And so we're really excited to continue to partner with them by offering a 1-year AARP membership on all of our IFP plans as well. So that's going to come with things like discounts on travel, groceries, and financial resources, and just a ton of other stuff that you can enjoy as well. So members can actually get access to dental and vision insurance through that AARP membership as well. So if you sign a member up for one of our plans that doesn't have dental and vision on it, they can actually access and get dental and vision insurance through that AARP membership. So a little bit of a hack there as well. So real simple, they enroll in one of our plans, and this membership is going to be available to anyone over the ages of 18. So anyone over the ages of 18 can enjoy this membership. They're going to get an access code once they sign up, and then they can take advantage of the discounts and all the great benefits that go along with an AARP membership. All right, so now I want to touch on our virtual first plan overview, and just kind of ignore the top part there where it says it's actually available in most of our states. Now this is a little bit outdated, as you can see. So of course it's available in Ohio, and our virtual first plan has done very well for us since it was introduced over the past couple years. In 2022, it was actually our best-selling plan nationwide, and over the past year, it performed very well once again. Especially in Ohio, I think it was, and we'll get to this in the last slide, number 2 or number 3 best-selling plan in the state. So it really offers a lot of value for what it is, and it is that virtual first plan. So what it comes with that 24/7 $0 on-demand primary care, unlimited 24/7 on-demand primary care at your fingertips, and this is going to be available through the provider Galileo. So we partner with Galileo, who's a separate provider. They have their own virtual provider network, who's going to be the provider for our virtual first plan. So these providers have a massive network of expert consultation and doctors all around, and those members will have access. They'll be auto-assigned a virtual PCP upon enrolling in our virtual first plan through that Galileo platform. But if a member needs to go see some in-network, they need to go see some specialists, they need to get lab work done or imaging done or what have you, they just need to get their referral from their virtual PCP, and then they will have access to our in-network Ohio ACA network to go see that specialty care. So if they can get care done virtually, then they have unlimited $0 care right there. But if they need to go see that specialty care, they can absolutely do so. They just need to get that referral, and then they have access to in-person network. They have a really great Spanish-speaking experience, Galileo does. So the app, the website, it can all be automatically translated into Spanish. If an iPhone detects that Spanish is the primary language, it'll automatically translate it into Spanish for them and match those members up with Spanish-speaking physicians. No surprise bills for a virtual first plan because all care access through the app is $0. Don't need to worry about any sort of surprise bills to come along with that. And then the last point here, just to clarify, if you guys have members out there that are really adamant about seeing their traditional brick and mortar PCP, they can do so on a virtual first plan, but they're likely going to incur some higher out-of-pocket costs with doing that. So we just kind of encourage members, and they get a virtual first plan to take advantage of all the great benefits that our virtual first plan offers: 24/7 $0 care, referrals, and a bunch of other stuff that virtual first can do. So as I mentioned, once again, that 24/7 access to care, along with that, they really do a great job of providing timely responses. So, we've had examples of a colleague of mine who was on vacation with her daughter. Her daughter developed a rash, and she was able to pick up the virtual first app and connect with a provider within minutes and get a prescription within the hour at a local pharmacy out of state. So they do a really great job of responding quickly and getting the care that you need. So as I mentioned, medications can be prescribed right through the app. It'll connect you with a local pharmacy where you can go and pick that medication up, all with just a few touches of the phone there. So they do a really great job of providing a really seamless, intuitive experience for our users. So as I mentioned as well, all consumers on our virtual first plan are auto-assigned a PCP as part of that Galileo network. So they get that virtual PCP. It could be, with that, it's not going to be the same one every time. It's more of like a group. So it could be a different PCP every time, but it'll be part of the same group. And then one more time, if that member needs to go see a specialist for lab work and imaging, they can absolutely get that done. They just need to get that referral from their virtual PCP. And then they would have access to our regular in-person Ohio ACA network to get that specialty care. So in terms of what Galileo doctors can treat right from the app, they can really do the whole spectrum. So every day from urgent items to cold and flu, headaches, stomach pain, they can treat that, to everyday items, your prescriptions and refills, and then all the way to the other side of the spectrum at chronic conditions, hypertension, even heart disease. So they can really do a lot from the app, and it's all $0. So it's all free virtual care there. So a lot of value provided by a virtual first plan, and that hence why it's been so popular over the past couple of years. As with the agent portal and some of the Jarvis enhancements, kind of want to switch gears into the tech side a little bit and talk about some of the enhancements we've made and are continuing to make on our tech side for you guys, our partners out there, just to make it life as easy as possible when it gets into this realm. So a couple of the enhancements we've made, member ID card can now be downloaded from Jarvis. So if your member is waiting on a new card, or maybe they've lost their card, you're able to now go in there and download their card for them, and you can send it to them. So instead of having to wait for it to ship to them and worry about all that, you can download it straight from Jarvis and have it to them real quick. Early pay, recurring payments is available on Jarvis. You can set up auto pay for your members. You can manage their account for them on there as well, so they can kind of set up their account, set up that recurring payment, set and forget, they're good to go. In addition to that, PCP selection, this is a big one. This is what a big point that our members were asking for. So you'll now be able to go in there and select a PCP for your member. It will give you access to our network there, and you're just able to go in there and select a PCP for your member and make it really easy for them. And then the last one here, application status. You'll be able to see the application status for all your members, and then you can relay that information to them and allow them to see where they stand in the process and really just provide that confidence for them. Along with some other enhancements, our book of business enhancements, you'll be able to, we did some work on that. You'll be able to really easily see your book of business, dig into each member there, see their details, really just making that as clear as possible. And like I said, we're continuing to make enhancements on Jarvis. So this slide will be updated with new enhancements as time goes on. We'll be sure to update you all with that when those get finished. All right, diving into our ancillary benefits now. So with our dental coverage, we are going to continue to make enhancements to our dental coverage as well. So some of the enhancements we've made this year: $0 copays for routine dental visits, cleaning and x-rays, up to two visits a year. With that free, no charge class 1. So getting your teeth cleaned and x-rays and all that stuff, $0 for that. $1,000 annual benefit maximum on our dental plans. This is available to adults 19 years or older. So continuing with that $1,000 annual benefit maximum. With the major and minor restorative dental care, those are your class 2 and 3. Those will be at 50% co-insurances that are also subject to the annual maximum. So that is dental coverage there. But the big point here is that $0 no charge for your annual cleanings and x-rays and things like that. Now on to vision coverage. We've also enhanced our vision benefit this year. So instead of paying what was a $10 copay for routine vision exam, it's now $0. So another $0 there. Zero's the hero. I think, Geoff, you told me that before. So $0 for
Okay.
the vision exams.
I hope I didn't coin that phrase.
Yeah. Well, hey, for the client, the more zeros, the better. So $0 for vision exams. We what was $10. Frames covered up to $130. Retinal screenings down to a $39 copay. $25 copay for scratch-resistant lenses. So those numbers have all dropped over the years, and I assume those continue to drop as years go on. So just making it more affordable for your clients, and of course, clients will get access to a large network of eye health providers and much more with this. So making it stronger as years goes on. All right, so top plans. Now I want to switch into give you guys some of the market insight that some of our performance over OEP in terms of what plans sold the most, what counties are selling the most, because I would assume that these trends are going to continue this year. And my hope is that this just gives you guys out there some more insight into some of our best selling plans, some of our hot markets, just so you know how to kind of focus your efforts and able to get maximum business from that. So starting on the left column over here, top selling plans overall. This is going to be a combination of top selling plans from our distribution partners, from healthcare.gov, and from kind of every sort of distribution channel that we have. So interesting that it's different from healthcare.gov. So starting with the overall top selling plans, UHC Gold Advantage Plus came out at #1 statewide. And some of the reasons that this plan performed really strong with us was that low deductible at $500, no charge for primary care visits, and adult dental and vision coverage. So a little tip about our naming conventions, you'll see when it has that Advantage Plus in it, those are going to be the plans that have that adult dental and vision. So look for that plus sign if your clients are looking for adult dental and vision. Second top selling plan overall was that Bronze Virtual First plan. So this is the plan we just went over with the 24/7 $0 unlimited care, virtual care, no surprise bills, medications can be prescribed. So still a top selling plan of ours for 2 or 3 years now. And then rounding out the overall top selling plan is UHC Silver C Advantage. Really low deductible at $150, low out of pocket at $1,250, and of course no charge for primary care visits too. So that Silver C is going to be a CSR 96 type plan. So someone who's going to be able to take advantage of the full cost share reduction. Now, top selling plans from healthcare.gov. These are going to be top selling plans just from the consumer. So just a consumer going on to healthcare.gov and choosing a plan for themselves. So I thought it would be interesting to include this in here, just so you guys know what consumers are choosing on their own, because it's a little bit interesting because it is different from top selling plans that maybe the majority of brokers or others have recommended to clients. So just so you guys know, I think it's kind of useful information to have. So at that UHC Gold Advantage is still #1. But the next two are a little bit different. So Silver Advantage is going to be chosen in second place with unlimited $0 virtual urgent care, $0 primary care visits, and then affordable tier 1 generics, which are of course available on all of our plans. And then rounding out that one is the Silver Advantage Plus. So same benefits as the Silver Advantage, the one above that, but it has a plus sign at the end. So that comes with adult dental vision coverage as well. So feel free to take these down. Just thought it was a little bit interesting that consumers were choosing different plans than plans that were sold by our distribution partners. So those are our top selling plans as of now through OEP and currently. Top selling counties. So these were our top selling counties in Ohio for OEP. Once again, top selling counties overall is a combination of distribution partners, healthcare.gov, everything combined into one. So Cuyahoga #1, followed by Mahoning, Trumbull, Clark, and Butler. And interesting, it's a little bit different than top selling counties from healthcare.gov. So once again, these are just consumer. This is the difference between all distribution channels and then just consumers going on and getting it for themselves. So Cuyahoga is still at #1, followed by Montgomery, Hamilton, Mahoning, and Warren. So once again, just thought it was interesting to include that in there for you guys, just so you know what some of the hottest markets are, and maybe that helps you guide your efforts and being able to market towards those counties and knowing the plans that are popular. I think should just help that process along for you guys. And then we're ending here with some network additions in Ohio. We heard you loud and clear, everyone out there, about the network and needing to make some improvements. So we're listening to that feedback. We're adding to our network as time goes on. So even right now, within the past couple of weeks, we've added some big names to our network. Christ Hospital in Cincinnati is now a network, and it was all of these additions are active immediately, and 1-1 plans will have access to these providers. So a big one there, Christ in Cincinnati is a big add for us, followed by Wyandotte Memorial and Upper Sandusky, another big name up in there. And for those of you out there, Sandusky was a really strong performer this year in OEP. So if you're looking for clients up there, Sandusky, Youngstown, and even some Dayton were really strong. So that's a big add for us. Wayne Healthcare, also now a network in the Dayton area. And then Fisher Titus Medical Center in Norwalk, Ohio. And then also, I forgot to put on here is Northern Ohio Medical Specialist, Gnomes, up in the Cleveland, sort of Sandusky, Northern Ohio region. So Gnomes is in network as well.
And if I could jump in here real quick, Mitch. Recently, Anthem clients received word that they're having contract issues with Christ, and they might be having to drop Christ Hospital in Cincinnati effective April 1st. So, unfortunately, it doesn't trigger an SEP, but, with you adding Christ for 1/1, that makes you all the more attractive. So, for those clients looking forward, you might be the go-to for Christ Hospital in Cincinnati, which is highly sought after. Thanks.
Yeah, that's great insight. And that's a great point there. And yeah, so we are continuing to add to our network as time goes on. So I appreciate the feedback that you all give me and keep it coming, as I'm able to relay that to our network team, product team, and make the changes that are going to make us more attractive for you guys and your clients as well. So with that, I just want to thank everybody for coming on this morning. And if we do have, looks like we got a couple more minutes. I'm good to go with that. If we leave some time for question and answer.
Well, as people, respond and provide feedback, I'm wondering if you could touch on the Medicaid redetermination a little bit.
Yeah. So with Ohio, Medicaid redetermination, we feel is going to be a really great opportunity for new business in the state. So we're looking at, and the numbers vary between at least 200,000. I've heard 300,000 people are coming off Medicaid within the coming months. So that presents a really great opportunity for those people that are coming off Medicaid to get on to an ACA plan. So I know as an organization, we are going to be having actually a meeting today discussing strategy about that. And so I should have some more information. I know our marketing team is working on getting stuff together to be able to be sent out to our distribution partners, such as you guys, highlighting some of the strategy and some of the ways that maybe we can help you guys capture some of that business. So either way, no matter how you look at it, there's a lot of opportunity out there with a lot of people coming off Medicaid with the potential to be on an IFP plan. So more information to come on my side on how we can help you guys capture that business.
Great. Well, great. And I really want to thank you for joining us today. Everybody will get a copy of this presentation. And, at this point in time, I don't have any follow-up questions to ask. And, we'll be revisiting UHC here in, a couple months. We'll do a refresh. So keep an eye out for that. By all means, if you have any questions or if you still need to be appointed with UHC ACA, give me a call or shoot me an email. And, Mitch, do you have any final thoughts?
Just want to end on thanking you, Geoff, again for the time, and everybody out there that joined this morning. If anyone does have any questions, feel free to reach out to me, or if you relay those to Geoff, I'm sure he'll get them over to me. And, I'll have more information coming out as we strategize for 2024, which we are doing heavily this month into next month. More information, new stuff will be coming out, and look forward to presenting in front of you guys as we have new information.
Thanks, everybody. Have a great day.
Thanks, everybody.